Investigation in asthma. In investigation, we done various tests. Lung function test, spirometry is done. It is useful especially in assessing reversibility. Simple spirometry useful in confirming the airflow limitation. Second is peak expiratory flow rate is done. It is useful in demonstrating the variable airflow limitation. Exercise test is done. It is used in the diagnosis of asthma in children. And indirect challenge test, release of endogenous mediators that cause the contraction of airway smooth muscle. These include exercise ecupenic, voluntary hyperapnea, ultrasonically nebulizer hypertonic saline, and dry powder mannitol. Chest X-ray, it shows hyperinflation of lungs. CT is done, mesobronchiectasis, then skin prick test is done. It is performed by intradermal injection of common allergens and checking the development of wheal and flare reaction. Elevation of serum Ig level is measured, and in treatment avoid the allergen factor. That is it is useful in occupational asthma. Then control the risk factor like active and passive smoking should be avoided. Control obesity. Individual intolerant to aspirin should be avoided, NSAIDs and drug therapy. Bronchodilators is used for the treatment of asthma. That bronchodilators beta adrenoreceptors are used. It is two types: short acting, long acting. Short acting are salbutamol, terbutaline, and long acting are bumaterol, salmeterol, and then we use adrenaline. Most commonly used agent in this group in the catecholamines. Then we use the methylxanthine. Theophylline is used as a drug. Route of administration is intravenous, oral or as suppository. It is given. Side effects are nervousness, nausea, vomiting, anorexia, headache. Aminophylline is also used. Mechanism of action of bronchodilator effect by inhibiting phosphodiesterase in airway smooth muscle cells. Dose is 5 mg per kg given slowly intravenously over 20 minutes. Anticholinergic drugs are also given, that is ipratropium, tiotropium. Inhaled corticosteroids are also useful in asthma treatment, that is budesonide is given 200 microgram. Cyclophosphamide is given at the dose of 80 to 160 microgram once a day. Systemic corticosteroids also useful, that is prednisolone, methylprednisolone is also given. Then we give anti-IgE, that is omalizumab, in the person who is exposed to allergens. Then we give leukotrienes modifier, that is montelukast, jafelukast, pranlukast is given. Dose of jafelukast is 20 mg BD, montelukast 10 mg once a day is given. Anti-TNF therapy is also given, that is infliximab is given. If it is not helpful, then bronchial thermoplasty is done.